Hello, may I remind everyone, especially for the participants, to turn on your video once the webinar will start. Good morning, everyone. It's already 10:01, so shall we start? Okay, good morning, everyone, again. Welcome and thank you for joining us on the second webinar hosted by the FEU Department of Political Science. I am Keb, your host slash moderator for this event. Today, we are lucky to have an honorable guest who will talk about the state of public health in the Philippines. Earlier this year, we were caught surprised by the rapid spread of the novel coronavirus. The Philippines is one of those countries that felt the impact of the pandemic. Initially, our COVID response was loaded by the World Health Organization. Yet, as time goes by, we have seen a rapid increase in COVID cases, which put us in the top list of the highest cases in Southeast Asia and around the world. Critics have pointed out our public health response and the government's priority vis-a-vis the pandemic. Today, our guest speaker will discuss the policy gaps and the prospects of public health in the Philippines. To formally start our webinar, let me call in the Associate Dean of the Institute of Arts and Sciences, Mr. Mark Isla, for the opening remarks. Sir Mark?
Hi, good morning. Can you hear me?
Yes, sir.
All right. To our invited speaker, to Dr. Ildefonso Fulgar, the Department Chair of the Department of Political Science, esteemed faculty members, student leaders of the Political Science Society, ladies and gentlemen, a pleasant morning. How's everyone? I hope you're all safe and sound in the comforts of your homes. Before anything else, I'd like to extend my sincere thanks to our guest speaker, Dr. Rainier Escalada, for graciously accepting the invitation of the Department of Political Science to be a speaker in today's talk on policy gaps and prospects in dealing with COVID-19. This is timely and relevant issue that we must discuss in this kind of platform. The topic of today's webinar gave me an opportunity to reflect on what had happened for the past 7 months since the community quarantine had been put in place as one of many efforts of the government to prevent the spread of the novel coronavirus or COVID 19. But before we headed for the longest community lockdown in the world, other countries are already battling the dreaded disease. I remember around third week of December 2019, the first 11 patients had been reported confined in a hospital in Wuhan, Hubei province in China. At that time, I thought I was lucky not to catch the disease because I visited several cities in China, including city of Wuhan, in November, from November until the second a week of December. After reading in some online newspaper that a deadly respiratory disease, which can be likened to SARS virus, which killed roughly around 800 and infected roughly about 8,100 people, including maybe 14 individuals here in the Philippines. Back in 2003, I thought maybe this can be easily contained, just like how countries back in 2003 moved swiftly to prevent the spread of SARS. I even told one of my friends who's worried about the worsening case of infections in other countries that I'm certain the government can effectively respond to the virus in case it reaches our shore. But I was wrong. From March to April, the cases started to grow in numbers. As the number of cases increases, our uneasiness, fear, and anxiety had also increased. Suddenly, our lives had been taken over by the virus. We were told to stay at home and take all the necessary precautions so as not to be infected by this deadly disease. As I watched the daily news briefing, I realized that the government is not prepared to contain the virus, or others argue, well, no one is prepared to prevent the spread of the deadly virus, even the richest country in the world. But we've seen some countries in Asia and the Pacific which were able to implement policies and had taken precautionary measures to one, prevent the spread of the virus, two, save the economy of their country. Perhaps during the months we spent in solitude, you'd ask yourself as to what went wrong, or what are the plans of the government, or when can we see the silver lining in all of this? Well, you're not alone. Ladies and gentlemen, in today's talk, our guest speaker will give his insights on COVID 19 and public health in the Philippines, on what are the policies that are considered effective, policies that needs improvement, and what are the prospects moving forward. For the past 7 months of having community quarantine, we were all exposed not just to the threat of contracting the virus, but also to the reality that we are at the losing end because of the state of our public health system. Well, if there's one thing that comforts me, it's the idea that we were able to increase the number of laboratories from one to almost 100, spread across the country, and we now have local manufacturers of PPEs and surgical masks. We were able to procure needed ventilators for patients with severe cases of the virus, so on and so forth. But I guess it's really a Herculean task. In the end, I just hope that we learned our lessons so that we become better equipped in case we are confronted with the same type of situation. To conclude, I'd like to thank Dr. Ildefonso Fulgar, the faculty members, staff, and students of Political Science Society for hosting this event. I do hope that the students will take this opportunity to identify issues and understand the policies needed in responding to this public health crisis that our country is facing. Lastly, I hope that you will actively engage our speaker by asking relevant and thought provoking questions about the topic that he'll discuss. Once again, thank you very much and enjoy the rest of the program.
Thank you, Sir Mark. Before we finally move on to the webinar proper, allow me to read some of the reminders for this webinar. First, we are currently being broadcast live via the Facebook page of Far Eastern University and Political Science Department. To our Facebook audience, if you have questions or comments, kindly type it in the comment section and we will course it through our speaker. Second, the webinar's format is in a town hall format. This means that the speaker will be interacting with us throughout his discussion. There will be discussion questions, hence everyone is encouraged to participate. Lastly, there will be an open forum right after the discussion. So if you have questions, kindly click the raise hand button or drop your message at the Zoom chat indicating your name and your year level. So without further much ado, let me call in one of the faculty members of the Political Science Department, Dr. Rita Cusho, to introduce our speaker. Ma'am?
Hi, good morning. It is my
Morning, ma'am.
honor to introduce to you the guest speaker for today's webinar. Our speaker is Dr. Rainier P. Escalada, MIPP MPM. He is the policy advisor, or he is the advisor on policy, advocacy, and capacity building at the Pan American Health Organization, World Health Organization, focusing primarily on malaria and other communicable diseases. He joined the organization as a technical officer in 2005 and has since coordinated strategic dialogue, health policy development, advocacy, and capacity building efforts alongside his primary responsibilities on disease prevention and control. He also currently serves in the core task force of the PAHO Disease Elimination Initiative, officially launched in 2018. Born and raised in Cavite, Rainier earned his social science behavioral studies degree, magna cum laude and class valedictorian from the University of the Philippines, Manila, and was awarded as one of the 10 outstanding students of the Philippines in 1995. A seasoned youth leader, college educator, and community doctor, he is a steadfast advocate for capacity building among individuals, institutions, and communities prior to his career in international public health. Happily married with 2 sons, Rainier also holds a Doctor of Medicine and a Master of Public Management degrees from the University of the Philippines, a diploma in global health from the Finnish Medical Association, and a Master's in International Policy and Practice from the George Washington University Elliott School of International Affairs. Let us all welcome Dr. Rainier P. Escalada.
Thank you very much for the very kind introduction, Dr. Cusho. Thank you very much, Dr. Isla, for setting the stage for our discussions this morning, and of course to Keb for moderating and the rest of the organizers for having me today. Magandang umaga sa inyong lahat, particular na sa mga nakikinig natin o kasama natin mga mag-aaral ngayong umaga. It's an honor for me to be afforded the opportunity to be your learning partner in today's edition of the FEU IAS VASE series, brought to you today specifically by the Department of Political Science. Before I proceed, I just have a couple of clarifications that I wish to emphasize. No, first is that I'm joining you today not in my official capacity or not as a representative from the institutions where I work in, but in my personal capacity as a medical doctor and as a Filipino who engages primarily in the practice of translating science into policy, as well as in advancing advocacies and developing needed capacities towards addressing problems that affect people. That's the most important thing. Second, you will also notice that throughout the course of our discussion, I'll be shifting in using the English and the Filipino language in our discussions. In my experience, issues and policies are best expressed in the language that we are most comfortable with. So I encourage you to do the same thing. No? If you're more comfortable sa pagsasalita ng wikang Filipino, there's no problem with that. Ang importante sa akin, ang malaga sa akin, ay may pahayag nyo ng tuwiran kung ano mang saloobing mayroon kayo. Third, and our hope, as already indicated by Mr. Likayan, is that you guys joining us via Zoom today, particularly the students, will be discussing with us indeed, no? Which means that you will listen well, share your thoughts, ask questions, and find your voice to speak. No student of political science should be afraid to share their ideas. Remember that. This is among the skills and competencies that you're being trained to be proficient on. Kailangan nyo magsalita at magpahayag. That's an important thing to remember. And with that, we shall begin our joint inquiry into COVID-19 and let me share my screen. Share. Are you seeing my screen now?
Yes po, sir.
Okay. Sorry. Okay, so we shall now begin our joint inquiry into COVID-19 and public health in the Philippines with specific emphasis on the policy gaps and prospects. Sorry. So this is the inconvenient truth of where we are now in terms of COVID-19 at the global level. So we have 36 million confirmed cases since this whole problem started in late December, actually in Wuhan. More than a million lives lost. Actually, the last time I checked is about 1,056,000, if I'm not mistaken, just this morning. A projected 5.2% contraction in the global economy. We are noting a heavy hit on the employment globally, disproportionately affecting women, and across the regions of the world. No, actually, unfortunately, for the people I served in this region, I'm actually located in Washington, D.C., serving specifically people in the Americas, Latin America, South America, the Caribbean. The contraction of the economy is estimated at 18.3%. This is the worst hit region, as noted by the ILO, no? Followed by the European and Central Asian region. Asia and the Pacific is 13.5%, Arab states, and closely also is Africa, 12.1%. Apart from that, the best case scenario that we're looking at in terms of the economic contraction is about 4.9%, or equivalent to a loss of about 140 million full-time jobs. This is the best case scenario, even if the economy rebounds for the rest of the year. No, worst case is that if we indeed experience a second wave, the dreaded second wave, this could result to as much as an 11.9% loss of working hours, representing about 340 million full-time jobs. So this is how much the global economy is impacted by COVID-19. This is also noted as the largest disruption of the educational system in history. I don't think I need to tell you this. I mean, we experience this as today. This type of educational engagement will not be happening. It will not be happening kung hindi dahil dito sa problema natin ngayon, no? And in terms of numbers, we're looking at 1.6 billion learners affected in more than 190 countries. Closures of schools affecting as much as 94% of the world's student population, greater percentage up to 99% in low and middle income countries like the Philippines. The worst thing, and the worst thing this is the thing that I'm very concerned about, this also means the exacerbation of pre-existing disparities, not only in public health, but in other aspects of our lives. We know, as political scientists, as social scientists, that we live in a very in a disparate world, wherein you already have reduced opportunities for many of the most vulnerable, children, youth, and adults alike, especially those specific vulnerable groups, poor populations in rural areas, women, refugees, persons with disabilities, displaced persons for one reason or the other, indigenous populations, which are for some reason are very close to my heart in person. So these are the things that bothers me every time. I do worry about patients, but my concern goes beyond what I see in the clinics because I know it's just a representation of the great effects of this type of a problem for us. So the question is, um, how do we solve a problem like COVID-19 or public health in general? This can definitely be very overwhelming for any of us. In my case, as I'm doing my work now, much of my work at home, um, I'm able to spend more time actually following the work of my family. That's I guess the good part of having the current situation. I'm now able to be virtually involved with my family who lives there in the Philippines. They're based in Cavite. And just very recently, about a few weeks ago, I came to notice my youngest son's fascination with puzzles. And he's this little boy. His name is Choi. And then at some point, I realized that we're practically doing the same thing, yet in different forms. No, we are both trying to solve problems. And in the course of our discussion today, I would like to share with you some lessons that I learned from my 3-year-old son Choi. And these lessons, no matter how simple you see them, is practically applicable to the work that we're going to talk about today. So the question is, how do we solve complex problems like COVID-19? We take down problems basically by analyzing, understanding, deciding, acting, and learning as we move forward. No? And instead of me going through these bullets, which is essentially my own way of presenting to you what you would learn from various political theories or policy theories, I would tell you how I saw my young son solve his own puzzle problems. And in many ways, this is the same way I think we should remember how to solve problems like COVID-19. Each time my son would see a puzzle, a new puzzle, he would automatically focus into analyzing and understanding what the puzzle is all about. And I think that's also very important when we see a problem like COVID-19. You have to learn what it's all about. In his case, he would look at the whole picture. You would see that he's trying to see the relationship of each pieces together before he disentangles the puzzle. No, and that's what we do with puzzles. We disentangle them and we try to put them together. That's what they're for. So in his case, after he disentangles it, he looks at the different dimensions of the pieces. In looking at the different dimensions of the pieces, he tries to see how each relates to each other. He's aware that in order for him to address the puzzle as a whole, he should be able to be familiar with what the pieces are about and the relationships of each other so that he can put them all together again. He also is aware that in case he has difficulties, he's able to have other resources to help him out. At one time that he was trying to put together a new puzzle, he was, he readily asked my wife, his mother, to help him hold a piece together because it's not that he doesn't know how to put them, but with his little fingers, he's having difficulty to make the puzzle stay. So I know that he knows the resources available to him. In order to put the puzzle together. He also is able to see opportunities. At one point, I was surprised that he ran away and took the picture of the puzzle that he was putting together, realizing that he knows that by looking at the picture, he will be guided on how the puzzle looks, and it's going to be easier for him to put things together. So again, the analysis and understanding is there. That principle is there, and that's how I want you to remember this process. No, more than what your books will tell you, the practicality of problem solving should stay with you. In terms of decision making, it was really very interesting how he automatically zeroes in on the centers of the center of the puzzle. I don't know if you can see this, but the figure of this puzzle that he's putting together is a fish, some sea creatures, an octopus, and I think that's a seahorse. When he puts together the puzzle, he automatically zeroes in on the fish first. And what he does is that he tries to put together those pieces so he can immediately restore the images of the sea creatures. And from there, I realized that it was a lot easier for him to start orienting all the other pieces together. So from the center, his work radiates and so on and so forth. So in no time, once he's able to put together the central pieces, it was easier for him to get the other pieces together. He also strategizes. I think a good strategy that I saw him is that there he tends to put pieces sections of the puzzle in groups. So some, after working on the center, he works on one quadrant and another quadrant and so on and so forth. So he's taking the problem one quadrant at a time. And then once he has those quadrants figured out, he starts organizing those bigger form puzzles into one quick big puzzle. So you see the thinking. This is a 3-year-old we're talking about. I'm not saying that my son is extra smart, but what I'm saying is that I think this problem solving instinct is with us all. We have the capacity to do problem solving. All that we need to do is really harness it. And in terms of how he acts, how he does it, I noticed that he is very dynamic. He doesn't, he's not worried that he was going to commit he's not so worried about committing mistakes. He tries pieces together. If it doesn't work, he tries the next piece and so on and so forth. So there's some sense of dynamism. He innovates. He turns pieces all around until they fit together. So he's learning by doing. And again, with that learning by doing concept, each time I realize, each time he tries to put the puzzles together, for example, he finishes the first time, the next time he does it faster and better. And the reason for that is because he learned what works and what doesn't work. And in a gist, that's how I want you guys to remember this whole process of policy making, of determining what can be done, the gaps and the prospects that we need to pay attention to. So let's move to this next slide. Remember, in my previous slide and in my story about my son, the first thing that we need to do in order for us to be effective in policy, in the policy process, is to understand the problem. No one can make a policy if you don't understand the problem. And the thing is, you don't need to be an expert in the subject matter in order to do a policy about it. What you need to do is to have the capacity to learn, to understand, to listen, and be knowledgeable enough to make important decisions. And so, if you want to understand COVID-19 policy, you have to understand at least the basics of COVID-19. So we're gonna delve in on this for the next few slides. So this is what we know now on COVID-19 based on the science as it is. COVID-19 is actually a coronavirus. You would know that. Its official name is SARS-CoV-2, meaning severe acute respiratory syndrome, coronavirus 2. It's a second one that has been named because the first one that was prominent enough to be named was the SARS that happened in right around 2008, 2009, if I'm not mistaken. It's also of the same family as the MERS coronavirus, which happened in around 2012, I think. The thing is, these viruses, the previous coronaviruses, were less infective or infectious compared to the current one. Actually, the MERS is a lot deadlier. A far greater percentage of MERS cases, despite the fact that they're fewer, actually died. No, so compared to the MERS, the current COVID-19, the COVID-19 is less deadly. The problem is it's more infective, a lot more infective. Okay, most common symptoms, we know this, or we are familiar with this: fever, dry cough, and tiredness, but this can also manifest in many different ways. No, myalgia, pains, nasal congestions, headache, conjunctivitis, sore throat. For among younger populations, this is quite common also: the loss of taste or smell, skin rashes, discoloration of fingers and toes. The relatively good thing about COVID-19 is that we know that despite the huge number of possible infections, about 80% would really have mild diseases that would not necessarily necessitate hospitalization. But with the amount of infections, because it's so infective, even if only 20% would, or 1 out of 5 people would who will end up in the hospital, that's still a huge amount or a huge number of patients. Okay, and unfortunately, a good proportion of that will actually succumb to the disease. That's what we know so far. We also know that at higher risk are older people, those with underlying medical problems such as hypertension, diabetes, heart lung problems, cancer, and other autoimmune diseases. However, we have to emphasize that anyone can catch COVID-19 and become seriously ill. Actually, here in the United States, I look at the latest statistics. Most of the cases in this country are actually found on the younger to the late adult age, around 18 probably to about 50. And the reason for that is these populations are the ones who are more, what you call that, who think that they're more they're strong enough to withstand the virus. So many of them are exposed and they get the disease, and a good number of them do have to suffer from either severe complications and unfortunately also succumb to the disease. No, and the other thing that we're noting right now is that this type of illness is not only in some cases is not only a short-term type of illness. There are long-term sequela. A few people who had severe illness, who were fortunate to survive it, actually suffer from multiple long-term effects and deficits. No, so those are among the things that we need to understand about it. There's also, you will hear this from some recent journals or news, that there's a proliferation of a certain mutation. It's called the the G614G mutation. This refers actually to a mutation in the spike protein. This is the representation of the virus. The red portions are the spike, and the spike is actually that allows the coronavirus to adhere to the receptors or the cells of the human body, and that allows the infection process to take place. No, the mutation, just to simply explain, um, the result of the mutation in this spike proteins is that it makes it more easily infectious. So we have now a strain uh, that is far more easily passed on than the original one that happened when it broke out in Wuhan. The first case, if I understand correctly, the first case that came to the Philippines really came from the Wuhan. No? There's the strain that came to the Asian region. A different strain came to the European region. Uh, the one with the mutation was the one that went through Europe and then eventually here in the United States. But as early as about a couple of months ago, I saw some reports, I think from the Philippine Genome Center, indicating that there's developing evidence that the such mutation is already within the Philippines in the country. I think they even mentioned Quezon City. I'm not so sure the latest update on that, but I did see some reports that this strain is actually in the Philippines. Anyhow, the the main thing to remember is that there is a more infectious strain that's proliferating. The relatively good news is that as far as we know, this does not necessarily mean a deadlier strain, although it's more infectious. Okay. There's also discussions about the way how virus is transmitted, whether it's airborne or droplet or so on and so forth. And it's actually a technical discussion that I would not necessarily engage you in. It's about the size of the particle. The smaller the size of the particle, of course, it becomes airborne. If it's bigger, then it's droplet, meaning as soon as comes out from you, from your respiratory droplets, it falls down, so it does not float around. Whatever the truth is, the we knew from the very beginning that there's a possibility of airborne transmission, and we know this happens in hospital settings, for examples, in places possibly with poor ventilation. No, this can happen. Again, if you have in a closed setting where you don't have very good ventilation, then naturally you would understand that airborne transmission or particles floating on the air or suspended air can be possible. At any rate, there is really no difference on how you would approach this problem in as far as prevention is concerned. Because whether they're airborne or they're droplets, you would still have to follow the same preventive measures, because they're the most powerful and they're really the first line of interventions that we need to consider. So these prevention measures, as you will hear many times over media, are the same thing. You have to uh, do frequent hand washing, physical distancing, wearing masks, avoiding close contact, uh, and of course, ensuring adequate cleaning and disinfection and good environmental ventilation in all closed settings. So that's one. I'm also going to run through some myths that I'd like you to remember. There are many talks about what's true and what's not true about COVID-19, but these are the things that I'd like to bring to your attention. One is that one myth that I'd like to address is that current point of care tests are as good as the RT-PCR. Point of care meaning the rapid diagnostic tests, the one that the stick tests. The current WHO recommendation is that the use of immunodiagnostic tests or these types of rapid tests are only for research settings. If you're going to use it, it's really primarily for research purposes because we don't really know how effective they are when they are used in the field. Many times these RDTs can be unstable. The reagents and so on are unstable, so they may not perform as well as they do in a laboratory setting. So for now, this can be used, but we have to take note that these are only used for research settings and should not be used for clinical decision making, which I think is the same policy that the Philippine government is using. What we're using there is primarily the RT-PCR for confirmation. Those who will use this rapid diagnostic tests are clear that this should be validated further by RT-PCR. The other one is that the issue of false negatives, because you're actually dealing with antibodies. An infected patient may or may not develop antibodies. So if you are detecting antibodies with your test, then it can result to false negatives, no? Okay, because depending on the course of the illness where the patient is, that person may or may not really test for antibodies. So that's really the problem in terms of the reliability of the test. There are other tests that are now in the pipeline. Particularly, you would hear it, antigen-based tests and saliva-based tests, which are all being pilot tested. I think in Baguio, if I'm not mistaken, they're starting to pilot this antigen-based test. The antigen-based test actually detects the antigen coming from the virus. So if you turn out positive for that, then it is a real positive. You don't really need to validate that by RT-PCR. But there's also possible that you may test negative and you're not sure that if you're really negative. So again, with antigen-based tests, a positive is a sure positive, but a negative is not necessarily a sure negative. Okay. So the takeaway for this particular myth is that if we have symptoms or or if we have exposure, you need to just practice or intensify your normal precautions and call your doctor to seek consult and get appropriate testing. Again, as far as I know, and which should be the case, it still is RT-PCR that you should use to get tested to really know whether you're positive or not. Next, I know that there are lots of circulating information on Facebook and even in your regular talks across the neighborhood of what's effective or what's not effective. And again, I understand that this is because everybody wants to have some cure, have some control of the situation. The problem with this is if that we depend on some of this, some can be harmful, and in some cases, it can create a false sense of security and lead you to become more at risk. No, so for example, I've heard of this Tuob. I don't know if there are people from you who are from Cebu or the Visayas. I know that there's this Tuob mania a few months ago, and in general circumstances that should be fine. But again, I realized that the problem in such treatment or an intervention being promoted is that it was being promoted as a panacea for COVID, which is not the case. No, so some people think that if they do the tuob like this is it's just a steam inhalation process. If they do this, then they will not contract COVID. And of course, true enough, a lot of people who did this with no other precautions suffered from COVID, and I know of several people who succumbed to the disease because of that problem. So for purposes of discussion, I will just tell you what we have scientific data for, what facts tells us really works. So these are the things. So I'm not necessarily going to go through this because this might be too detailed for these purposes. But just to run through some of these, we know that again, 5% of COVID patients, the most severe forms, would need intensive care facilities. For example, right in the out of statistically, I mean, if you're going to think about policies, if you have 100,000 cases and you know that 5% will be severe, that tells you that you would need at least from 100,000 cases, you would at least need for 5,000 beds for ICUs in order to address that problem. So again, this is the reason why I want you to understand the profile or the epidemiology of this disease, because it's gonna you need that to calculate or to have some sort of a basis for what you need to prepare yourselves for. No, so you cannot uh, uh, avoid this. If you want to do policy on something, you need to understand some real details of the problem. And again, the good thing is that you don't need to be a medical doctor. You can consult people who knows this stuff and be guided in decision making. At least you just need to understand what these things are all about. In terms of treatment, only two or three, or only two for now, are known to contribute to treatment relief. A steroid drug called dexamethasone and remdesivir, which is an antiviral. Just the same, this does not cure the disease. What it does is that it actually helps shorten the admission time. It increases the capacity of the patient to recover faster. There are other treatments that are helpful, but still under research. No, so the key takeaway is that for now the science is still evolving. We know that some things work, but we know also that some things do not necessarily contribute to it. And the mistake that we can all have is that to think that something is treating us and gives us a false sense of security, and in some cases lead us to stupid decisions and mistakes. No, so I'd like to bring that to your attention. Not, another myth that I'd like to address in particular is about the issue of vaccines. Um, the people are asking if we do have effective vaccines right now. The answer is no. We don't have any proven vaccine that you can use currently, but we do have a very fast evolving science. We have about 26 COVID-19 vaccines out of 167 being developed. It's now on various stages in human trials. 9 of them are in the phase 3, which is very close to to the final stages. Uh, they are from different countries. They are using different modalities. So hopefully one of these will really turn out to be a very good vaccine that can prevent or can help us avoid the bad sequel of the disease. Um, but again, we also have to grapple with the reality that despite these advancements, and dami yan, it's 167 trials. Some of you may say, of course, some one or two would come out. But historically, even in other diseases, it is possible that none of these will come out really well enough for us to use, no? Really well and safe enough for us to use. So the message is we should be cautiously optimistic. I mean, all of us would like this to happen, but we cannot just put our hopes entirely on vaccines. And if you think about it, hope is not a strategy. Yeah. So while we have to strategize on I'm always hopeful. I'm a very optimistic person, but realistically, as a policy person and as a strategist, I don't rely on my hopes. I mean, I look at my guns and I use whatever I have, and then hopefully merong ibang armaments later on. But the same way, I don't rely on things that are not certain. And then we also need to understand the context that we have in the Philippines, because we're doing policy. We're talking about policy in the Philippines. We need to understand some basic concepts on the Philippines. So we talked about global situation, the sciences we know it. Now let's discuss now what we know about COVID-19 in the Philippines. As of a few hours ago, I checked. You have about more than 330,000 confirmed cases and about 6,000 lives lost. Just putting this to perspective, since the first case in the country, which is about January 30, if you calculate it, you have about 1,314 cases every day. So that's how many cases you have. Kung average mo lang yan every day between January 30 and now, that's amount of cases that you're having in the country every day. Deaths. It's somewhere around 24 deaths every day or 1 death every hour. At that rate, bago matapos tong call natin na ito, there are at least 2 other people who dies of COVID again. And to me, that bothers me on a very personal level. Hindi lang bilang isang doktor, kundi bilang isang Filipino. I mean, these are very real things for us, and I'm sure many of you would have known someone, whether close enough to you or someone you know enough well enough, who have either suffered or maybe even passed because of this problem. In terms of our economy, this has been heavily published. The economy shrunk the most in the second quarter of this year. the lowest record in 30 years. The World Bank projects a 1.9% contraction in our economy, one of the better scenarios that was posted. The worst that I've seen is about 8% contraction for 2020. So again, these are estimates. Unemployment. I don't really need to talk about statistics with you because I'm sure in your neighborhoods you see these people. These are just not numbers. I mean, in your families, I'm sure there are people who lost their jobs, people that you know. So again, these are numbers. And while this speaks to me as a research person, as an academician, I know that even if I do not talk about these things, these numbers to you, you know what these things are all about because you experience them or you know people who experience them. Labor participation affecting women more who have less opportunities for work, although statistics also show that in terms of underemployment, more men are affected. Again, the disruption of the educational system, the DepEd reported about 24 million people enrollees, and we're talking about the K to 12 programs, hindi kasama yung mga college. Um, we have a lower enrollment this year, particularly because of a lot less enrollment on private schools. I know that a lot of private schools have closed from K to 12 private schools because they don't have the capacity to offer online or alternative mode of education given the current context. And again, this continuing problem on exacerbation of pre-existing disparities, even without COVID, back in 2015, which is the latest data I've seen, the Philippines has been noted to have among the highest inequalities or inequities in our region in Asia, based on the Gini index or measure. So with those numbers and statistics, apart from that, I think what's most important for us to be conscious of is the actual effects and impact of COVID-19 in our lives. So instead of putting more bullets, excuse me, what I tried to do in the slide is to show some photos. Some of these are personal photos from my collection, and the others from the internet. And this shows the effects on the various aspects of our lives. Remember, I was telling you my child Choi was looking at the dimensions of his puzzle problems. I think we need to do that. We need to look at the dimension of this problem that we're dealing with. And these dimensions refers to the aspects in terms of health, socioeconomic, governance, politics, behavior, culture, education, environment, administration, and policy. So looking at health, for example, this is how the health situation looks like. And again, I told you some of these photos are personal for me. This is a photo of my cousin. She's a young medical doctor. She's now with among the volunteer doctors in PGH, seeing COVID patients. Um, she left her residency to join the PGH team, COVID PGH team. This is my wife in yellow on her PPE gear. So these are very real for me. These are pictures, but I am part of the health sector, and I know this situation. I know how it is to be there. And these are just pictures of the economic impact. No, I mean jeepney drivers na mga walang pasada, walang kabuhayan, mga mamamayan na umaasa lang ngayon sa dole out. The beginning of this problem, and in some cases hanggang ngayon wala pang ayuda. This communicates to the political issues or political problems that we have. We have issues concerning credibilities of some of our leaders. The problem that we are now seeing on the leadership of the House of Representatives. We're now seeing the dimensions in our culture, for example. A lot of people who are so used to have church as part of their work are not able to go to church. Even if they do in a very limited capacity, our transportation, the way of commuting has changed a lot. No? So these are types of problems and dimensions we're looking at. Education, these are photos. This is my elder son. He's now attending his flag ceremony at home in the comfort of his room. He's doing his exam right now as we speak, virtually, and we're very fortunate because we have a relatively comfortable life. But in some cases, for some students, and I presume also maybe in some of the students we have this afternoon or this morning, uh, things are a little bit more challenging. This is a person, a student who has to attend classes uh, in a outdoors because that's where the signal is. This boy is listening from the top of his home because that's where the signal of uh, he gets for his internet para makasali sa kanyang mga klase. This is an environmental issue. Where do this hospital um, waste. How are we managing this? We're not even probably discussing this, and this is far even more problem. Problema na to before, I'm sure. Pero how much more ngayon? Because mas marami tayo mga medical waste na ginagamit, hindi lang ng mga tao from hospitals, but even regular people who wear masks and gloves and so on and so forth. And then we have a lot of other administrative or other problems classified, the corruption in PhilHealth, the problems with your utilities. I mean, magbabayad ka na lang. Just the other day, my wife was complaining uh, because my mom is having problems with her phone. And the charging is also, yung mga charges nila ay hindi maintindihan ng mga tao. You have problems with protocols on badges, on permits, and so on and so forth. And then, of course, you have the policy dimension. The government did try to respond. No, actually, as to date, as I understand, there are at least two big laws that they passed already: the Bayanihan Act One to act as to heal as one, and the Bayanihan to recover as one as well. No, the Bayanihan Two. So these are just the dimensions of the COVID-19 situation that we're looking at, and um, instead of me talking about all those details, what I'd like to do is to ask you, kayo naman yung hingi namin magbahagi sa tulong ni Mr. Likayan. I would ask some of you to help us answer these questions and share us your thoughts o yung mga karanasan niyo by answering this question. Batay sa inyong karanasan at ng inyong pamilya, ng inyong komunidad, ano ba ang mga pinakamabigat na epekto o suliranin na naidulot sa ating buhay ng COVID-19? So we'd like to hear from you, at least in this section of our discussion. So, Mr. Likayan, can you facilitate, please?
Hello, would like to answer, or shall I have to mention names? Okay, may I call on Karen Espiritu if you're there. Can please unmute your microphone? Is- Wala ba si Karen? And then maybe we can call Jag Alvarado. Jag. Uh,
Ay po, sir. Good morning po. Sir, nandito po si Karen. Pero sige po, ako na lang po. So, good morning po, Mr. Escalada. Good morning po din, Mr. Dicaya.
Good morning, Jack.
Narinig niyo po ba ako?
Yes,
yes.
Jack.
Okay po. So, yun po. So, to share lang po my experiences po. Kasi po, di ba, yung, yung mga health protocols po ngayon, di ba? Mabigat po siya lalo na sa mga senior citizens. Tapos po, yung dito po kasi sa bahay namin, meron po kami isang senior, yung lola ko po. Tapos nagda-dialysis po siya every Monday, Wednesday, Tuesday, Thursday, and Friday, and Saturday. So, for me po, parang ongoing na siya for a few months now. So, siguro po sa personal ko po naramdaman, parang every time na may lalabas po ng bahay namin, parang hindi po ako mapakali kasi di ba po syempre parang halos every day nare-risk po yung contact. Tapos hindi po namin alam kung kung nahahawa or hindi. Tapos po parang 2 beses na yung facility po kung saan nagpapadialysis nagkaroon ng positive, tapos same room po. Pero thank God naman po, hindi pa po hindi pa po kami nahahawa. So yun lang po, parang kahit po hindi ko siya directly nararanasan, parang may epekto pa rin po siya psychologically sa akin with all the pressure that's been going on din po sa iba't ibang mga ginagawa po yung mami ko po nag-work. Tapos po, kami po online classes pa. Parang hindi lang po health yung kailangan problemahin ngayong pandemic. Pati po yung mga psychological effects po nito doon sa mga tao, lalo na po sa mga parents, estudyante, yun lang po.
Thank you. Yeah. Go ahead, sir.
Sige. Nagpasalamat lang ako kay Jag. Go ahead, Ken.
Yeah,
Okay
thank
na
you.
po.
Thank you, Jag. Who would like to volunteer to answer this question, discussion question? Kindly click the raise hand button. Yes, Danica. Danica, paki-assist naman technical team. And then we'll have Claire after Danica.
Hello po. Good morning po.
Yeah.
Yes,
Morning.
Narinig-
Danica.
So siguro po yung pinakamabigat po na nakikita kong problema po nung nangyaring pandemic na to is yung hindi yung mga taong responsable po sa sa pag-action sa nangyaring to, hindi po nila tinitake seriously yung buhay ng mga tao na nasasakupan po nila. Kasi po ang nangyari po yes po, may maaari pong may mga maliliit na naapektuhan, pero 'di ba po dapat lahat ng boses napapakinggan. So, ang nangyari po kasi nadi-disregard po yung boses ng mga naapektuhan or direktang naapektuhan. Kasi po ang nangyari po ay iniisip po natin na yung buhay po nila ay mas less kaysa po sa iba. So, ang nangyari po, kumbaga, may buhay pong nagiging mas mahalaga kaysa sa iba. And yun po yung feeling ko pinakamalaking problema po. Kasi po, kumbaga, hindi na po natin pinapahalagahan yung buhay ng tao kasi feeling po natin, wala naman po silang naaambag sa lipunan. So, pakiramdam ko po yun po yung pinakamalaking suliranin po natin.
Thank you, Danica. Yes, Claire?
Good morning po. So, base po sa aking karanasan, naisip ko lang po is the pinakamalaking problema is the administrative effectivity. Kung paano nila ina-actionan. Kasi if you will look at it, some places is effective nilang nagagawa. Like Pasig ni Vico. Tapos, yung iba naman po, like in our localities, hindi po siya masyadong nararamdaman yung COVID response and its effectivity po sa amin. So, marami pong naapektuhan since marami, hindi naman tayo pantay-pantay ng level sa buhay. So, merong mga super nahihirapan, meron naman medyo stable lang. Pero yun po, parang isang mahalaga na pagtuunan ng pansin is that the effectivity of the elected officials, yung mga LGU natin, is that sana maano po siya, parang sana matuto na paano kung mag second wave pa, edi mas lalo pang tatagal yung pandemic, mas lalo pang tatagal yung ano po ng economic status po natin sa Pilipinas. So marami pong naapektuhan. So yun po, yung pagiging ano po ng effectivity po ng administration po natin. Thank you po.
Thank you, Claire. I think we have also one, Carl David.
Sir, I would just like to give my opinion about it po. It is in support of Ate Claire's statement. To be honest po, I keep on wondering how other countries are handling it better. Some of them have a more prosperous economy than we do, of course, but few of them are poorer than we are as well. And so I have come to figure that this pandemic is without a doubt a big problem for us. However, there's a bigger complication that we are facing, and it is having leaders who are impervious to criticisms and have no sense of priority and accountability at all. Countries like Vietnam and Thailand are able to execute their new normal well. So why can't we? Ako po, I have personally witnessed people being put behind bars because they're still going outside to work or they're still not wearing PPE. So sa akin po, why can't we give them masks instead? Or bakit hindi natin sila bigyan ng mas extensive na tulong? So, di ba, parang jailing them won't solve the problem kasi the marginalized are continuously being oppressed. So I see tricycle drivers here in our village still trying to survive and work in order to serve food on their table. So ayun po, and we have loaned trillions of money from other countries, and yet none of us know where the money really went. So I guess if only those who are in power or in the positions have focused more on improving the healthcare system in the country and not treat this pandemic like a gunfight, maybe we wouldn't be in a 7-month lockdown at all po.
Thank you, Carl. Meron pa bang would like to give their insights or would like to answer the question? Uh, okay, I guess wala na po, sir. Uh,
Okay,
yeah,
sure.
thank you.
I will continue, but before I continue, I'd like to applaud you guys. No? I mean, and congratulate your teachers. You guys are very smart people. I'm very proud of you. In a sense that this is really easy for me, in the sense that I really don't have to tell you what the problems are more than anyone. And I was telling this to uh, to Dr. Kush earlier, that more than anyone, between me and you who lives here in the Philippines, you probably have the greater expertise to tell me what the problems are. And that is in fact true. No, in a short period of time, within minutes, you generated for me new things. Like for example, overlooking the needs of senior citizens, of sick people who are, other sick people. How do we take care of the health problems other than COVID? That is really true. I mean, this is not just about COVID the whole time. Hindi COVID lang ang sakit ng mga tao ngayon sa Pilipinas. How do we take care of the others of illness? Um, how about those people who are left behind? And people left behind are not necessarily now poorest of the poor. The middle income people are also being left behind because there are no specific programs for them. That's why I'm gathering for you. Problems and administrative procedures. No, local governments are implementing different administrative procedures and permits and so on and so forth. At kung ikaw ay lilipat mula sa isang town to the other, malamang maluloka ka kasi hindi mo alam kung anong rules yung nag-a-apply mo, depende kung nasaan ka at a particular point in time. No, just a specific example. And as our last student has mentioned, there seems to be a problem of leadership, and I guess this is not only at the national level but across different levels of leadership. So again, I'm very proud and very happy that you're able to identify these. So if you're asking me what the policy gaps are, I think you know the answers, know what these policy gaps are. So let's move into this. Now let's hold your thought on what those problems you're talking about, and now let's see what the government response has been so far, and that will really allow us to have to figure out. So what are the gaps? So what is our government doing versus what you see are the problems, and by reconciling them, that's how we see what the gaps are. No, tingnan natin the response. No, so the biggest policies that were passed in relation to COVID-19, as I understand, are these two Republic Acts. No, 11469 and 11494, Bayanihan to Heal as one act, and Bayanihan to Recover as one act. No. I think this is a clear try of response from the government. No? But let's see what it contains. No? And I encourage you to actually read these particular laws, so for you to be more familiar with what exactly it contains. But just a gist. No? Bayanihan Act to Heal as Act 1 has specific responses and components, particularly one on the medical response, medical aspects of the problems. It does give aid to the poor household, the poorest of the poor, apparently. Unfortunately, does not include the middle class, which is also as effective, if not more. The economic or productive sector, yung mga businesses, private sector as well. It communicates the duties of the citizens, what we should be doing in relation to the battle against COVID-19, and it's also the punitive aspects of the policy. And then, as from my perspective, when I review the Bayanihan Act, it's really just a continuation or as in further support of the Bayanihan to Heal Act 1, because it just extends the emergency powers of the president up to December. It provides specific budgeting for key aspects of this very similar priorities in Bayanihan to Act 1. The main difference is that now it does consider educational needs, still is very focused on economic measures. Now it still has support for healthcare facilities, but you compare, for example, the much of the focus of the resources are on economic measures compared to support for healthcare and hospitals. And I have no strong opinion about this. I'm not going to say whether this is right or wrong, but you see, the prioritization as it's coming along based on the budgeting for these two laws. No, and what I'm gonna encourage you to do is at some point take a look at these laws and see whether sagot ba ito sa mga sinasabi niyong problema natin ngayon? Sa mga problemang na-experience niyo sa pang-araw-araw. And that's how you answer the question of what are the policy gaps. No? I'm not going to answer that question for you because I know you know the answer to those questions better than I do. Okay. So now let's look at, before looking at solutions, so that's the next stage, I'm going to engage you also into the exercise of knowing what our strengths and weaknesses are and the opportunities for us. No? Because in order for us to come up with solutions, we should not only be conscious of the problems, we should also be conscious of the resources that we have in order to respond to the problems. So this is just a collection of pictures also to communicate some of the ideas that I have as regards this. So in terms of strengths, we are known, and I think psychologically, we really are very resilient people. To be honest with you, I've been to so many places in the world in my career, and I think we do have one of the the happiest people, the people who are able to adjust despite the most difficult circumstances. Mga pulubi sa atin, masasaya, nagingiti. Ano, in other countries, they're so miserable. uh, um, health workers, we have one of the best trained health workers, the most empathic workers, health workers. So I think those are assets. We have, in general, very people who have strong faith. I think we suffer less from stress. Despite very difficult circumstances, because of our capacity to anchor to our faith, to our culture, and and recover from isang ano yan, a hidden epidemic all across the world, no? And I'm not saying the Filipinos are not affected, but in the scheme of things, I think we have better capacity to cope with stress in general. And of course, we have you guys. No, we have people like you, younger people, who I continue to believe are fighting for a better future. And that idealism, I don't think you should lose. No, so I consider that a strength. In terms of weaknesses, one particular weakness that I really see in our country is the disparity. You see in this picture, the in one picture, in one setting, you actually see the poorest of the poor and the richest of the rich. So I think this is a weakness. We have a very inequitable society. Now this one direction picture is my attempt to appeal to your senses, but what I actually would like to communicate here is that for some reason I observe that Filipinos tend to commit same mistakes and over again. We don't learn from history. How many of you know our history well? I mean, paulit-ulit lang tayo ng storya. And I think kailangan pag-aralan natin ang ating kasaysayan ng mas mataimtim and to learn our lessons from them, not to commit them anymore. We easily forget the lessons of history. And I hope we learn our lessons now as we experience through COVID, so that we don't do this doesn't happen again to us. No, this is a cartoon about our health system, and then I don't need to tell you about this. If you go to our hospitals and our public health facilities, you would know what I'm talking about. In this particular circumstance, while yung pagiging clannish, yung big families ng nating mga Pilipino, I think in many cases is an asset. In this particular instance, it can be a weakness because we're dealing with an easily transmittable disease. So yung ganitong kaugalian natin na lagi tayo nagsasama-sama, hindi mapaghiwa-hiwalay, in a sense can become a weakness. No? So this is something that we need to learn, at least for this time or this period, learn how to minimize. No? This time around, consider other measures na paano tayo makakapagsama-sama pero physically distant pa rin. And this is the time for us to innovate on those things. Going to innovation, the good opportunities I see in the current situation is that instead of just giving up and being in despair, this is an opportunity for us to innovate. I mean, we know what we want. We can't do it the way we normally do it. So let's figure out another way to do it and get what we want. This is an opportunity for us to innovate. E-learning, well, no one is ready to do this e-learning, but this is something that we need to address right now. So let's make the most of it. Maybe this is an opportunity for us to explore alternative sources of learning. And I'm glad that somehow it's working for many of us. I know it's more difficult than for some, but let's take this in stride. Let's have this as an opportunity to learn from this and at makisabay. No? Kung hindi man tayo maging sabay-sabay lahat, at least magtulungan tayo para walang maiwan. There's another here also in terms of this is a personal thing as well, no? It's very strange that in this time that we have been advised to maintain physical distancing in many ways, this has allowed me actually to be closer with friends. Actually, the reason why I'm here right now is because I was able to get in touch with long lost friends and colleagues. No? And so Dr. Kusho and I were able to reconnect, and so she invited me here. But if I guess if this COVID thing did not happen, we would have been, you know, still long lost friends. I have not seen her for a decade at least, probably, if not mistaken. Um, and of course, this is a moment for us to question whether our self-reliance and the sustainability of the things that we do. I'm so sure that many of us thought that we can sustain the lifestyle that we've had in the past, and now everything has totally changed. So this is a time for us to revisit those things and concepts. No? Okay. So let's go now to another aspect of this whole process. No, how do we decide on solutions? Here are a few things that I would like to share to you based on my own experience. I'm not going to tell you what the solutions to these problems are, but I'm going to tell you what solutions, how we come up with the best solutions. One is must always remember that the solutions must respect our priorities. And I'm very, very strong in my opinion on this. If you are going to do public policy, you have to remember that the center of your work and the center of your policy would have to be people. If it's public policy, your center is your people, your families, your communities, nothing else. If it's just policy, then maybe it can be something else, no? But if it's public policy, the mere fact that you're talking about the public, you cannot put the people away from the center. And remember again, my kid, in the center of his puzzle are the fish and the sea creatures. In the same way, when you look at the puzzle that you're creating or the puzzle that you're dealing with, you have to always remember that you have to put people at the center. And from then on, everything else will follow. No? Kung alam mo, if you know your core and you know your center, then you will not be lost. That's how I learned my public policy work. Solutions and strategies must be relevant and effective and based on evidence. Okay, you have to remember that it cannot be a guessing game. It cannot be just purely based on what you think and what you feel, especially if you're not connected to the ground, if you're not connected to the people being affected. One of you talked about it earlier. Para bang yung ibang mga leaders natin hindi naman naiintindihan kung anong pinagdadaanan ng mga tao sa baba. And remember that when you're in that position of leadership and decision making, bumaba kayo. Alamin niyo ang nangyayari sa mga tao around you. Tanungin nyo yung mga taong nakakaalam ng problema at ng solusyon, and don't ever think that you're the smartest person in the world and you know and you decide for people. You have that power, but probably you're not the best person to think about what the solution should be. Also, solutions, multidimensional problems require multidimensional package of solutions. COVID-19 will not be addressed by a single policy, much more a unidirectional policy. It has multi-dimension. It has health aspects, socioeconomic aspects, political behavior, and so on and so forth. So if you have a problem that's multi-dimensional, the response should also be multi-dimensional. The response should include people like senior citizens that you're talking about na hindi na napababayaan, ng mga regular na pasyente na may nasakit na ibang klaseng sakit. So all those aspects should be taken into consideration in order for us to come up with a response in a policy or a response that is relevant and effective. Solutions must be easily understood, respected, and implemented by corresponding stakeholders. And this is the reason kung bakit importante o mahalaga na bumaba kayo at tanungin kung ano ang problema at ang solusyon sa mga problema. Because the only way you make people own a policy is if they make it themselves, if they put their inputs into it, so it becomes their policy as well. Sometimes the process is as important as the response. If you are legislating from the bench, if you are doing policy work on the comfort of your office, believing you're the smartest person in the world, then you already failed. The best policies are made through consulting people. And then solutions must consider the resources, costs, logistics, and because you have to understand that the answers cannot be found only in a single sector. That it's not in your hands. Even if you're the most powerful government, you will need to collaborate because there are certain aspects that are best done by other partners. So collaboration is important. And in the scheme of things right now, it's very evident in COVID-19. This is a problem that we cannot address just by ourselves, not in your family, not in your own home, not by our own country, just by our country, but this needs to be addressed by a global community by collaborating together. Okay, your turn again. Tanong natin sa ngayon. Batay sa ating mga karanasan at sa mga narinig na nating epekto, yung mga sinabi ng ibang mga kasama natin ngayon, ng mga suliranin na dinudulot ng COVID-19 sa buhay natin at ng kapwa natin mga Pilipino, ano yung mga karagdagang solusyon o pagbabago yung mamumungkahi ninyo? Na sa palagay nyo ay hindi pa nako-cover, particular na ng mga pulisiya na nagmumula sa gobyerno natin sa kasalukuyan. So parang kung kayo yung bibigyan ng pagkakataon na magbalangkas ng solusyon, ano yung mga solusyon na iisip nyo? Base na rin sa mga problemang na-experience ninyo o sa mga problema na sinasabi nyo kanina. Over to you.
Okay, so would like to for those who would like to answer, kindly click the raise hand button so we can unmute your mic. So we have here Carlo Alvarez from the first year. Yeah, Carlo, go ahead.
Good morning po.
Morning.
I think one thing na pagkukulang ng gobyerno natin is to look at the disenfranchised community, the disenfranchised sector of our economy, which is, for example, the tricycle drivers, the people who operate jeepneys. We do not see a concrete platform or plan to help them go through this pandemic. We have seen efforts to slow down or to even eradicate the ways of lives of especially jeepney drivers. We must look into a holistic solution according to the speaker. The government lacks the perspective that touches on holistic sectors of the government. So I think ang kailangan po gawin ng gobyerno is to look at the bigger picture and not to isolate itself to the people of the privileged. Yan po.
Thank you, Carlo. Next, maybe we can call Kira from first year. Kira.
So, good morning po.
Good
For
morning.
me is, i-support ko na lang din po yung sinabi ni Mr. Alvarez about economics. So, for me, there's a lack of pagiging compromise within the government and the society on how kung paano po yung magiging flow, kung ano man yung talagang kailangan ng society. Siguro po kailangan ding mas pakinggan yung boses ng bayan sa pamamagitan ng pagko-compromise kung ano man po yung mga pangangailangan, tsaka knowing na madaming nawalan ng trabaho at maraming kailangan punan ay kumpara sa mga ibang pinagtutuunan nila ng pansin. So yun po.
Thank you, Kira. Yes, Gerald Balisok from third year.
Okay, good morning po. Ang
Alright.
nakikita ko pong problema na suliranin na idulot ng COVID-19 ay yung hindi nag-concentrate or hindi binibigyan ng focus ng mga legislators natin or ng mga gobyerno natin yung specific needs ng mga tao. Ang pina-realize yung mga personal interest nila, yung mga political agendas nila. Ganyan ang nakikita natin yun sa legislators na nag-away sa pinag-uusapan nila yung kung sino ang maging house speaker. Sa sitwasyon ngayon, dapat ay hindi ito yung pitutunan natin panunin. Dapat ang focus ng ating mga batas ay yung kung paano pagtuunan kung paano aksyonan yung malaking problema which is yung COVID-19. And ang pansin ko sa ay parang ni-utilize ng mga tao sa gobyerno yung pagiging resilient ng mga Pilipino na to the point naging kampanya mapapansin sa ni President talaga pinapansin na hintayin natin yung vaccine, konting tiisang, try to survive. Kumbaga, ang makakita natin sa mga yun, walang konkretong plano, kumbaga inaasa na lang sa pagiging matibay, pagiging resilient ng mga Pilipino. Kumbaga naabuso yung pagiging resilient ng Pilipino, which is mali. Yung pagiging resilient ng mga Pilipino ay hindi mali, pero yung to the point na pagiging complacent yung mga politicians natin, yung mga representative natin, ayun yung hindi tama. And ayun yung nakita kong na-expose, lumabas sa mga ngayon sa banat po natin.
Thank you. Sir, we have a lot of students who would like to participate.
I know.
So,
I mean, I'm happy. No, they're
yeah.
participating.
So we'll call them one by one. So maybe we can go with I think Claire first kasi kanina pa siya. Then we'll followed by Joel, and then we have Lady, Maxine, and Justin, and then Joshua and sino pa ba? I think that's all. Yeah, Joshua. Okay, go ahead, Claire.
Ayan po. So, with this question po, ang gusto ko po na parang karagdagang solusyon is the policy on the accountability of public officials, since it is in our rights na for public access sa mga public documents. And sa mga nakikita nating balita na we have mga utang, napakadaming utang, and hindi natin masyado nakikita kung saan ba siya napupunta, and yung transparency po is, I guess, I think na talagang need siya sa public administration na ipakita sa public sa locals kung saan ba napupunta yung pera nila and anong action yung nagagawa ba talaga nila.
Thank you, Claire. Sino yung next na tinawag ko? Joel, I think, I guess. And then we'll call yung mga nasa chats. Go ahead, Joel. Unmute. Paki-unmute si Joel from third year.
Hello, sir. Good afternoon po.
Good morning.
Ay, good morning po. So yun sir, yung sa akin po sir is sana po mas maging research based po yung plano ng mga ng gobyerno natin para mas maging concrete po siya. So dapat po yung gobyerno natin should always look from the politics below po. Kasi ang mas naapektuhan po kapag po nagplano sila po kasi yung pinaka nasa taas. So pag nagplano po sila ng walang konkretong plano, ang mas naapektuhan po yung mga tao, lalo na po yung mga marginalized sector po. So dapat po siguro mas paigtingin po ng gobyerno natin yung research based po bago po sila magpatupad ng plano. Yun lang po, sir.
Thank you, Joel. Right after Joel, we'll call Joshua, and then yung mga nasa chats. We have a lot of students who would like to engage with this, sir. So please bear. Okay, Joshua.
Hello, am I audible?
Yeah, go ahead.
Okay. Good morning. I think ang pinaka-problem with the policies being legislated ngayon is parang hindi siya scientific. Yung mga nilalabas na press conferences parang hindi well thought yung opinion na sinasabi. For example, yung advice na use gasoline as a disinfectant, sobrang misinformation doon is lalo na kung as a government official tapos magbibigay ka ng hindi well thought na advice is very dangerous, lalo na kung it is endangering the public health. Tapos, you can see the misalignment of parang yung priority. For example, kakapasok lang natin sa top 20 ng pinakamataas na cases, pero they're still pushing na i-reopen kaagad yung mga tourism spots, which parang malaking threat siya sa local transmission ulit, lalo na hindi pa parang totally nag-ease. We're still receiving 2,000 plus cases per day. And we're currently at 300,000 cases. So very alarming na gusto ka agad nila i-reopen yung mga sectors na yun. Ayun lang po.
Thank you, Joshua. Next is Lady Maxine. technical team kindly assist?
Hi, good
Ah,
morning po. So I'm Maxine po from first year. For me po, we all know naman na we have contact tracing na, but I want parang for me po, we should emphasize on it more kasi what's happening right now is that magfi-fill up ka lang ng form or whatsoever kapag papasok ka ng mga facilities or restaurants and all. Pero is it really nagagamit ba siya? Really nagkakaroon ba siya ng effect? Kasi nakapasok ka na before, pag nag-fill up ka ng form, makakapasok ka pa rin naman without assessing kung talaga bang may COVID ka ba or what. And for me, yung contact tracing po yung isa sa mga magagandang plano sana if we could um, mas magiging maayos pa sana or yung pagpa-facilitate sa kanya. Kasi as of now, we all know how alarming the cases are going. It is increasing a lot more than than it should be. So dapat po yung contact tracing talaga yung pinakapagtuunan ng pansin ng government natin to para mas madaling ma-eradicate sana yung pagtaas ng COVID cases. Ayun na po. Thank you.
thank you, Maxine. Next is Justin from second year.
Hello, good morning.
Good morning.
Considering the current condition of the Philippines, I've noticed that there's a lack of consistency when it comes to policy and guidelines. We need to expedite the process kasi kapag sa ibang bagay nagagawa ng paraan, ang bilis pa nga po, right? Sana same goes with COVID response. Strictest and longest lockdown yet COVID cases still elevating. We need to start utilizing our own resources. We need to contextualize solutions that are fit and appropriate in the community, locally. We need to start listening to the best and the brightest of the country. Ang problema kasi ngayon, ideas and opinion are abundant, pero they are being neglected. Reality, right? So how can we develop effective policies if you are not listening to our people? We need to develop a policy that will be effective locally by listening and weighing every problems possible. Thank you.
Thank you, Justin. Next is Sierra from third year.
Hi, am I audible?
Yeah.
So, good morning po. So, I think yung biggest na mali and misunderstanding sa policies na ginagawa ng government is hindi sila tumatanggap and nag-include ng opinions and advices from the experts talaga. Like, why would you even parang get opinion from a person na hindi expert dun sa field na yun? So, I think dapat mas gawin nilang priority yun and concern to really set some parang advices from the experts lang talaga. And if they're going to make something like the Bayanihan Act as one, parang make sure that it really embodies kung ano yung pinaparating nung act. Kasi it's really not parang it's not really nag-advocate and exclusive or like inclusive sa mga kung sinong nangangailangan. Kasi I think yung policies na ginagawa ngayon ng government is really anti-poor. So yan po.
Thank you, Sierra. Sir, should we entertain all or?
We can a couple of more and then later actually hopefully may question and answer pa tayo, no? So we can
Yeah.
entertain.
So yung iba na hindi matatawag, maybe we can entertain during the open forum. Next would be Ulysses from first year. There are a lot of first year right now.
Good morning po. I would just like to add up dun sa mga sinabi po ng mga previous speakers. I think tama po yung mga sinabi nila. We do need to prioritize more yung healthcare natin and medical facilities, medical mga ginagamit ng mga frontliners natin. And then there's also this thing na I noticed our funds yung mga linoloan ng government from different banks, they're actually using it for this build project, which I think is very unnecessary for at the moment. I think we really need to address the issue first, no? One step at a time muna dapat. Hindi muna natin dapat sana sabay-sabayin yung mga like for example yung build nga, I think it should be addressed later on after we overcome this pandemic na lang sana. And then I would also add yung personally speaking kasi we have poor internet connectivity. So I think it would be good since everyone especially yung mga students ngayon, they depend on sa online classes lang, and without a stable internet connection, nagkakaroon din ng mga problems para sa kanila. Tapos it's really hard. Like it's definitely the biggest struggle right now as a student. And then yun nga po yung sabi kanina ni Maxine, yung sa contact tracing. Yes, we need to make it more efficient kasi if we don't make it that efficient, magiging lang, parang mas rami lang ng rami yung cases natin, and parang wala ding dulot yung contact tracing ngayon kung hindi natin siya i-improve. I think we really need to take all these these aspects and improve it in any way that we can, so that magkaroon tayo ng clear na plano how to overcome this this pandemic. Yun lang po. Thank you.
Okay, I think, sir, we will entertain two more, and then yung mga hindi matatawag, then they can share later on, siguro.
Sure.
That would be good. Okay, so we will call Hafsa from the first year and Jericho, and then for those who will not be called, you can share later yung insights at the open forum. So Hafsa.
Good morning po.
Good
For me
morning.
po personally, I think the people in the government lack empathy po on the people because kasi they usually base their actions po on their personal thinking po. Like, hindi po nila kino-consider yung voices ng people because they think they are right po. So I think po na kasi mas maganda pong we think of the people because yun po para sa akin important work ng people from government or the public servants. We should think of po paano po kung tayo nasa position nila kasi hindi naman po lahat tayo privileged, and mas maganda po na i-focus po natin since the lives of the people is more important. Although I know po naman na meron po silang ibang gustong fino-focus na for the good of government rin po or in the country po. Pero yun nga po, mas important po yung life ng mga mamamayang Pilipino po. And I think we should think of the cause and effect before proceeding po. Kasi po like, hindi naman po tayo sure kasi there's a lot of unexpected things po na pwede pong mangyari. Pero mas maganda po na kahit po sa cause and effect, mas maganda po na sure tayo na maganda po yung maidudulot, lalo na po sa mga Pilipino po. Ayun po. Thank you.
Thank you, Hafsa. And last is Jericho. Jericho.
Hi sir, narinig na po ba?
Yeah. Go ahead.
Po. Good morning po. Echoing the same sentiments po ng lahat. Amidst this crisis po that we're all facing today, I think po marapat na rin po siguro na maging objektibo po yung pananaw ng ating pamahalaan. If only our administration po will start to redirect their priorities po. Cohesive plans po will follow. And hopefully po, it will be executed by reliable people. And with regards naman po to assistance, I think po equity should prevail po in times like this. And anti-poor solutions should have no place to manifest po. And given the time po na ganito tayo ngayon, na affected na po yung ating economic stability, we must not compromise din po the health that may further wound the workforce po na meron tayo today. Yun po.
Thank you, Jericho. I think that would be all, sir, and then we'll entertain the rest. So go ahead, sir.
Thank you. Thank you, Kev. We'll continue. No, I'm really amazed by the ideas that you've been telling me. Some of you focus on problems again, but again, also alluded to solutions. So let's see. I mean, I'm going to compare your ideas with mine. No? And in no way do I want to say that this is a complete list, but because what I did was just, again, I'm here in Washington, and the only thing I can do is think about the problems and solutions. But again, I alluded to the fact that between me and you, I think you're the experts to tell me what the problems are. And in a lot of the things that I heard from you, you guys are either affirming some of the thoughts that I have here, or even contributing more. I mean, I'm learning from you as you speak. No, for example, in the areas of health. No, we're talking about, some of you talked about the need to prioritize health, the infrastructure, so that the health response could be bigger. I did hear this, but I somehow there's uh, one problem I realized also, just hearing from the news, is about the conditions of the health workers, for example, no, and not just the health workers who attend to the patient, kasama yung mga security guards, yung mga manong-manong sa, all of these are exposed individuals, and it seems that they're not getting the benefits, or they're among the populations left behind, no. I mean, pare-pareho lang naman ang at least sa mga yan, pero happy ako siguro for some of the direct frontliners like doctors and nurses, pero naman napapag-iwanan yung mga security guard, yung mga manong na tumutulong sa ospital, hindi naman nakakakuha ng parehong benepisyo, no. And again, without me discussing all these points, I think it's gonna be moot, because you're already telling me a lot of what I listed here. Just for example, transparency and accountability reforms in governance. Again, I was just thinking about this, but this is something that you guys talked about. Reforms against uh, about distance education, the need to address the difficulties, for example, that students are. See, I mean, I'm happy that I think we've opened this discussion, and I think this is how you should be. I hope this is how you guys are in your classes, whether it's a theoretical class in political science, or applied political science subjects, that you're able to relate yung mga teorya with actual real life experiences, because that's in my own experience, that's how I was able to first concretize and understand and remember my theories, and even apply it in my own work right now. So pag 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 unawa mo ay naka-anchor, hindi lamang sa utak, kundi sa araw-araw mong eksperyensya, nakikita mo ito, you live your theories, then you'll be a more effective practitioner of the discipline that you're in, no? And that's why I'm encouraging you to think through and relate yung teorya na natututunan ninyo sa inyong pag-aaral sa actual life experiences. And that's how you make your learning holistic. The beauty about engaging in political science, in the social sciences, is that mas may oportunidad ka na gawin ito sa pang-araw-araw mong buhay, because you deal with people, you deal with your own experiences, and that's why I encourage you to do. So I will not be prescriptive in what I think should be the policy prospects. Again, I think this exercise demonstrates to us that between you and me, you probably know better what the prospects for policy is. Ano bang kulang na pwede na ating address? Ano bang solusyon na walang solusyon? No? Yun ang solusyon na natin. Ano ba yung problema na hindi na-address ng kasalukuyang sistema? Then yun ang pagtuunan natin ng pansin, di ba? Yun yung sagot sa tanong na ano ba yung policy prospects. And again, these are my ideas, but it turns out I think you have better ideas, and they're just not ideas, they're realities. And then that's how you deal with these types of problems and questions. No? Okay. Some I call this hacks in terms of dealing with policy problems and prospects. Key questions to consider, no? Hindi naman lahat ng bagay, lahat ng problema kailangan ng pulisiya. Kasi if that's gonna happen, you will not move along. The policy process takes a long period of time, no? Hindi naman lahat ng bagay kailangan. May mga bagay, may mga problema na masusolusyon mo na with kung anong meron ka existing tools and solutions. So wag mong pahirapin yung buhay mo. Pero so here are questions that I think we should always remember, and some of you actually address this in your comments. So first, you have to ask: is there really a need for a policy to address a problem? So if there's yes, then explore. I mean, what type of policy do you need? What is the problem? Again, all about you go to the policy process. Intindihin mo yung problema, alamin mo yung iba-ibang dimension nito, ano yung mga solusyon na pwede, based on evidence. I think I heard that quite a bit from a lot of you. So that's important. And then kung hindi naman kailangan, and then you just use your tools, no? Another consideration is that you may not necessarily need to have a new policy. There may be an existing policy, pero pwede siguro kailangan kailangan i-review lang natin o i-consider natin kung kailangan i-amend o palitan. So that's another process that needs to be done there, no? In some cases, some of you alluded to the problem of policy implementation. It may not be a problem of the absence of policy or no clear guidelines. It may just be a problem na hindi naman ini-implementa yung polisiya na meron tayo. So that's a totally different problem. So ang problema doon, pag ganun yung problema mo, kahit ano gawin mong polisiya at kung hindi mo na-implementa, wala rin, di ba? Parang yun yung tinatawag na drawing. No? Yeah. This work that we do in policy, hindi to drawing, no? Kasi kung drawing ang gusto mong gawin, hindi dapat ito yung kurso sa'yo. Pwede siguro arts or yung magdo-drawing ka talaga, literally, no? But if you would like to come up with solutions, there has to be an implementation strategy. There has to be operational plans, which is something that you guys also talked about, no? Na minsan may polisiya pero hindi klaro kung paano mo implement, hindi klaro kung paano mo i-operationalize para makasagot talaga sa pangangailangan ng mga mamamayan. And also, there's a need for us to realize that hindi natatapos ang isang polisiya sa pamamagitan ng pag-implement nito. There's this process, this part of policy evaluation. You try to look into whether your policy works, whether there's a problem in implementation or the solutions that you thought about was really effective. So a policy process also involves the learning, a generation of evidence. So you have to see whether there's evidence na nag-work yung polisiya mo. Pag hindi, adjust mo, palitan mo. Kung nag-work siya, then do more of what works and avoid doing the things that don't work. Ganun lang yung thinking doon, no? Kung ano yung tama, gawin mo. Kung mali, i-stop mo yung mali, di ba? So, more importantly also, you have to constantly think about how do we integrate lessons learned to optimize the effectiveness of our policies, okay? So, these are among my last few slides. So, in terms of acting, remember, if you remember yung mga steps na natutunan ko sana kung maliit, there are certain things that we should be able to observe when we act, especially when we implement policies. For example, we have to embrace the change and act dynamically. I mean, this picture saying change just ahead. Actually, this is wrong in a sense because change is now with us. And if change is there, instead of fighting it, you deal with it. No, you don't come up with policies to avoid something. You come up with policies or solutions to address the problem. Again, we have to be innovative. Alam ko it's change is always difficult, change is always inconvenient, but this is an opportunity for us to adjust, to practice that proverbial resilience natin mga Pilipino and solve problems no matter what. Again, there are no problems. I always tell when I was still teaching, I always tell my students, if a problem does not have solutions, then it's not a problem. Because by definition, a problem needs to have solutions. So kung may isang problema ka na piling mo wala kang solution, hindi na problema yun, di ba? So no matter how difficult a problem is, you should be able to find the solutions. I mean, I'm amazed by the amount of opinion and intelligence that your class, for example, has. And I couldn't imagine that if you combine your brains together and your capacities, I can't imagine any problem na hindi niyo masosolusyonan. Okay? So the other is, you talked about this also, being proactive, managing risk, understanding the consequences of what we're proposing. It's important to solve problems without creating more problems. It's important to anticipate problems that may be coming along so we can manage it earlier and not be just reactive, no? Again, going back to this lesson that we'll have to learn to do better each time. We have to learn in the process. Magkakamali at magkakamali tayo sa pag-address ng isang problema. Ang mahalaga, natututo tayo kung magkamali man. We avoid, of course, trying to commit mistakes. But if we do, we learn from that and not do it again. And that's why I remember yung aking One Direction picture na same mistakes. I think many of us are very guilty of that. Now, we tend to commit same mistakes historically and even in our personal lives. No, so let's try to be conscious of that. And again, to always think that we have to be clear with what we're targeting. That there's a clear enemy. In this particular case of COVID-19, the clear enemy is this disease, this virus, and not each other. So the strategy should be to collaborate against the enemy and not against each other. So this is one of my last few slides. Some evolving practices. So lessons learned. What works? No, we don't. Fortunately for us, again, this is a or fortunately in the sense that this is a global phenomenon. There are countries where we can learn from specific things that that we know works. These are some of the countries that are noted to have done better, a lot better compared to the others. For example, I listed just a few. There are a few others that's worth mentioning. Pero just to call your attention to a few things na I know works. For example, in Australia, what I personally what I would note is that the fact that despite the difference in the political spectrum, the Australian leadership was able to come up with a solid approach to how they deal with the COVID-19. So comparatively, their cases and deaths are far less than many other countries, their status. No, there's also a strong deference to scientists. Follow the science, follow the evidence, which is, as many of you have mentioned, may be lacking in the response along some agencies and our government. No? So alam natin na mali yun, and see, tama kayo na countries who did otherwise are doing better in terms of their performance in addressing this. New Zealand, for example, they have done a lot of things, no? But one thing that caught my attention was really this moral leadership, the symbolic move taken by the prime minister and government officials, for example, to take a 20% cutoff in their salaries. I mean, that's little. I mean, it would up. That's hindi naman yung nakatulong na malaki in terms of monetary resources, no? But the moral leadership is there, and we need that, and the world needs that, no? For people to see that you're the leaders of your country, the leaders that you consider, they got your back. They will suffer first before we do. I think mahalaga yon. Sa Taiwan, again here, an important aspect I'd like to highlight is that the applications of lesson learned during the SARS outbreak in 2003. Many of you probably mga paslit pa noon, hindi na naalala yan. For a while, it was a scare. It did not go to the magnitude that we have now, but Taiwan was among the hardest hit. The good thing about Taiwan is that they learned their lesson. And so when this thing came in, even after 17 years, they remember their lesson, and now they're among the best. It's among the best performing areas of the world or territories in the world. So that's the importance of learning our lesson. We had a SARS problem as well in 2003, not the same magnitude as the other countries, but we could have learned our lesson there. We also dealt with with other epidemics in the past. But I don't think that we learned our lesson well enough. Singapore, I was particularly impressed by the capacity or the government leadership and straightforward communications. For a time, I remember in the earlier months, ang dami ko nakikita sa Facebook na was, sana all. Have you seen the Prime Minister of Singapore communicate to their people? It was decisive. It was clear. He was talking about the truth, not sugarcoating. Inspiring confidence that despite the difficult situation, your government has your back. Your government is doing its best. And that's what we're talking about. You talked about this leadership, and you're correct. Those things are important. South Korea took this seriously from the very time that they got the problem. So from the get-go, they mobilized their system to be effective in epidemiologic vigilance, extensive testing, and so on and so forth. And the good thing about them is that they did not only stop working on new technology to address their situation, but now they're exporting tests and medical supplies also. So again, there are a lot of good reasons or good experiences from other parts of the world that we could learn from. And again, the answers to the question of what are the prospects, what are the possibilities, we can look at other countries, the experiences of other nations, and figure out, if these things can work for us as well. So I've come to the conclusion of my presentation, and shortly we will hopefully have some time for question and answer. I do not expect really for you to remember every single detail, much more the geeky statistics that I presented. Those are just to show you that the way for us to learn is to base this on facts. No? You will not remember those things, I'm very sure. But I am hoping that at least these 5 points you will remember. And if it's too much, if it's not too much to ask, I hope for the rest of your lives. One is always remember that we all have the capacity to influence policy, our direction as a country, and our lives as Filipinos. We just need to find our voice and cut through the noise. And I think many of you did that, especially on the second question. So natutuwa ako ng dami nag-raise ng hands. Now you're starting to communicate. Always remember that your voice is valuable. You have something to say, then say it. I know it's a tedious undertaking, but so is a puzzle for a young child. If my 3-year-old son can address a puzzle, you can address any problem. Because it's the same thing. It's problem solving. Kahit anong disiplina o kahit anong inaaral mo, it's a problem solving exercise. The principles are the same. You got this. I mean, you know how to do this. Instinctively, as a child, you know how to solve problems. So how come don't be afraid to try your hand in solving problems, whether it's in politics, whether it's in other field or medicine or something. There's a solution for this, and you can do your best to try that. Third, just like a puzzle, public policy is a problem solving exercise. We take problems down by analyzing, understanding, deciding, acting, and learning as we move forward. We cannot skip steps. Hindi mo pa naintindihan yung problema, may solusyon ka na. Kailangan alamin mo yung problema bago ka makagawa ng solusyon, and you take time to learn as you implement your solutions. Next is that, again, public policy is about people. If people are not in the center of what you're doing, you have no business in doing public policy. You can do policy, but not public policy. And again, remember, and more importantly, live by your FEU core values. Unfortunately, I'm not from FEU, but from what I know, your main values are fortitude, excellence, and uprightness. We need people who have fortitude more than ever. We need people who excel, not just for the purpose of being good, but for the purpose of being relevant. We need upright people, people who would lead us to the right way of doing things. And hearing you guys today, I am confident that if you continue the path that you're taking right now, and you remember all these things that we discussed today, even just these 5 points, you will make not just your alma mater proud, but you will turn out to be, the kind of people that our country needs. Maraming salamat at magandang umaga ulit sa inyo lahat.
Thank you, Dr. Escalada, for that interactive and substantive lecture. Before we proceed to the open forum, allow me to read some of the comments from the earlier questions, sir. So from the Facebook, from China Marie, sabi niya, government should see to it that policies would solve conflicts in the long run. Kasi ngayon, instead of focusing on the current issue about coronavirus, we stumbled from previous problems tulad na lang sa rice tariffication law. If it would have been properly implemented, hindi na siya magre-resurface today. And also from Andrea Hidalgo of first year, I think dapat yung solusyon hindi lang para sa maaaring makaka-afford, dapat maging inclusive kasi yung kung palaging uunahin yung mga VIPs, then patuloy lang na mahihirapan yung mga marginalized, and the government should see to it na rather than making solutions now for short term, they can allot budget on making something efficient in the long run. So we have also engagement from our Facebook audience. So for now, we will be opening the floor for your questions. I think we have limited time, so we'll just entertain few questions. Again, please introduce your name and indicate your year level. You may click the raise hand button or type your message at the Zoom chat. And to our Facebook audience, same. You may type your questions in the comment section and we will read it. So I guess we have questions from the comment boxer. So I think we'll start with it. So we have from Aaron. Regarding education at all levels, sir, what do you recommend? Go back to face-to-face classes or blended? The next one is the late imposition of a travel ban in the entirety of China. Did the president and DOH secretary neglected their duties under the Article 2, Section 15, which is the state shall protect and promote the right to health of the people and instill health consciousness among them? Sorry for the long answer and thank you for answering it. Sir?
Should I answer first? Okay. I think there you have two
Yeah.
questions there. Uh,
Yeah.
Recommendations on face-to-face versus blended learning. Again, yeah, this is a general answer. No, in order to for us to come up with relevant policies, we have to look at the data at a granular level. We cannot come up with really national uniform policies. It has to be tailored. Ang sitwasyon ng COVID ay hindi pare-pareho. We have a different situation in the National Capital Region, in Region 4 and so on and so forth. Kung wala ka namang masyadong kaso, I think it's probable for us to do blended even on face-to-face learning, no? Posible yon, no? So again, in this particular, that's why we need to pay attention to the data. We need to pay attention to the evidence that will guide our decision making. I would compare this to the way we practice medicine, for example. Pag may pasyente ka sa isang clinic or sa isang ospital, you look at your parameters para matrace mo kung nag-i-improve o hindi yung iyong pasyente. Pag gumagaling siya, binabawasan mo yung or tinatapos mo na yung paggamot. Pagka lumalala, kinagamot mo pa ng masyado, di ba? So the same way, you have to look into the context of a particular locality. So again, if your parameters are showing you that you have less and less cases, then you can open a bit more. But again, in the current scenario, this will change. So pwede yung mangyari na may time na konti ng kaso mo, mag-open ka, tapos biglang dadami naman. So ang strategy mo, babalik ka ulit ng konti. So that's why we need to have a flexibility, some sort of flexibility. Hindi yung pag nag-decide ka na ngayon na, okay, face-to-face na tayo, papanindigan mo na yan forever hanggang kahit na nakikita mo nagtataasan na yung kaso. We need to be flexible in that sense for this particular case. And again, those decisions have to be made on a more granular level. Next, on the question of the possible neglect in instituting the travel ban, to be honest with you, even at the earliest days, the recommendation from WHO was not necessarily to suspend travel right away. No, that was clear because it was earlier. It was the science was not fully understood. We did not fully understand how contagious this virus is. Only at some point did we see the evidence to say that okay, travel bans might indeed be needed, and it worked for those countries who actually instituted early. So I would not necessarily penalize government who were more conservative in those travel bans. I understand those, but what is more concerning for me is the actual response. Travel bans would have not really stopped the problem. It would have delayed the problem. Pero what would have stopped this is, for example, contact tracing. That's how you you go after cases, no? Point in case, and again, I don't want to to engage in the politics of the United States. The current government, Tagalog ako, baka may makapanood. Yung gobyerno nito, ang pinagmamalaki niya, kinat nila yung flights agad sa China, pero hindi naman kinat yung flights galing sa Europe. Pumasok yung kaso actually from Europe. At ang problema pa, for a long while, yun lang yung strategy na yung borders, iisarado yung air borders nila sa China. So nangyari, patuloy na pumasok yung kaso from the other border dito sa East Coast. Patuloy na lumaki yung kaso sa isang bansa na kaya mag-contact tracing ng malakihan, ng malawakan na hindi naman nila ginawa. I think that just doesn't make sense. You have the resources and you did not use it. And that's why, remember in the discussions, I want you to know what your resources are because your solutions will also depend on the resources that you have available. So ganun ang pag-unawa dito. Depende sa sitwasyon mo, depende sa resources mo, kung ano yung pinakamahusay na solusyon na pwede mong gawin. And understanding fully kung hanggang saan ang magagawa ng intervention na yan. The closure of borders would have not prevented the spread of the disease. It would have just delayed the spread of the disease. But kung yun lang ang strategy mo, it would have not worked. Yeah.
Okay, I think we have really limited time, so I don't think we can entertain all. So maybe if you have questions, maybe we can forward your email, sir, if they have direct questions to you.
Sure.
Because we don't really have enough time. So now we will proceed to the what do you call this? The next part of this webinar, which is synthesis, and allow me to call in one of the faculty members of the political science, Mr. Danilo S. Cortez Jr. Sir. Uh, sir. Um, um, Technical team, kindly unmute, sir.
All right. So how about this time? Can you hear me?
Yes, we can
Yes,
hear you.
sir. Go
Right.
ahead, sir.
Thank you, Sir Cabert, for that one. And then my task today is actually a gargantuan and difficult task of presenting to you the synthesis. Okay, our program synthesis. So my task is to present the program synthesis, focusing on the central ideas based on the underlying themes or patterns that transpired in the webinar. And of course, I would like first to congratulate our distinguished resource speaker, Dr. Rainier P. Escalada, for a wonderful and very engaging and productive discussion. Okay. Again, it was very interactive and participatory, given that the setting was allowing people to engage, our students to engage, and also empowering them at the same time, giving them their voices and showcasing their also reflective insight and as an active participant of this webinar. But let me present to you the idea or the central ideas. And I have come up with three. Number one, of course, I would like to focus on puzzle that was mentioned by our, highlighted by our resource speaker. Another central idea is referring to perspectives, okay? And then the last but not the least is people. So first, let's discuss puzzle. So yes, we acknowledge, given the in the start at the beginning of the seminar or discussion of the Dr. Escalada, he was able to give us the general picture how complex this COVID-19 pandemic is, the complex nature of this public health crisis, given the severe threat and even being described by our speaker as really it's an inconvenient truth that we have to accept. And as we speak, there are increasing number of cases worldwide, and as of counting, there is 36.3 million, all right, COVID-19 cases worldwide. And in the case of the Philippines, there is around 331,000 COVID cases. So as you see here, given that kind of data or figures, you'll see that this public health crisis is multinational. It's global in nature. But of course, it doesn't end there. We should also acknowledge that, as mentioned by our resource speaker, it's also not just multinational, but also multidimensional, given that there are different issues, different societal concerns that we have to acknowledge and recognize in order for us to address the problem. And then also, in addressing this, we should also have an approach that is multisectoral. So we don't just look at the health sector as a single entity in order to address the virus or in order to address this pandemic. So it's not only a concern about public health, but we have also, it has a greater impact on our economy, our education sector, even our well-being, our mental health at the same as well, and even the dynamics of political landscape that is also, changing and even being taken advantage by some people in power or those interest groups. Okay, and at the same time, ecological challenges that we have also experienced, as well as restrictions in our mobility, as well as the aspect about security. So I would like also to acknowledge that in this puzzle, we are also experience the exacerbation of the pre-existing disparities as mentioned by the speaker, meaning that there is a greater vulnerability, okay, for the disadvantaged member of society, especially the poorest of the poor, and then the indigenous people, even the um, people with disability, okay, or the different abled individuals. You see here that the approach is that it's really problem solving when we look at public policy, and we are looking for solutions. And then it was compared to a puzzle, like put and and as compared to like a child completing a puzzle, you see that there is also strategy on how we can solve that puzzle by looking at the general picture. Second is to look at the different dimension, focusing on the central pieces of the puzzle, and then grouping or using quadrants. That's another strategy. And then at the end, it's actually learning by doing, okay? And identify what works and what doesn't. But also, at the end of the day, we should also not just compartmentalize all these pieces of puzzles that we were able to build together. But we should not have that, silos, okay, or leave them being compartmentalized. But we have them to, put them together, and just like in a general picture where we started. Another is, I'm done with puzzle. Now let's proceed to perspective. So perspective, a lot of us has a lot of, voice, a lot of different opinions, ideas, but we have also to focus on evidence. Okay, research-based was mentioned, referring to science, data science specifically, even pure and natural science, but also social sciences, including political science, will also be a great contributor to the success for addressing this problem. Okay, and then also speaking and listening to voices from different perspectives is crucial. From the people, from the academe, from the students, from the research pieces that we have come up, from the think piece, and also from our papers, okay? The thesis that you will make, your undergraduate thesis when you are already in the start of writing or coming up with your own study, okay? And then of course, we have also to listen to other members of society, like community organizations and even non-governmental organizations. And at the end of the day, we have to listen to the people on the ground in order for us to make sound public policy. And of course, it doesn't end there. It doesn't end in policy, but there should be effective and efficient implementation of this policy. Because without that, we are not going to realize, whatever sound policy or public policy that we have crafted. And then, of course, we have to have a proactive societal response. So the focus here in perspective is that we have to be, just like student-centered learning. Students as co-producer, as co-creator of knowledge. Just like it should also be the same thing when we apply it to public policy. So on public health, okay, so meaning it is critical that participants and different stakeholders of the society participate in the co-production and co-creation of solutions to address this public health emergency or crisis. That's why it's critical to be part, that everyone in the stakeholders will take part in that kind of endeavor. Community involvement is essential. Our health system must be integrated and coordinated. Yes, this perspective will pave the way for a more pluralistic. Yes, maraming mga ideas, maraming mga opinions, yet it will also give us more contextualized and localized understanding of the public health crisis. Because this scenario is not just happening in just as a one case, but we have to understand what is happening at the local level, which is based on science, based on economic and sociocultural consideration, and of course, based on lived experiences of Filipino people. Hence, also, it is important and crucial to strike a balance between international benchmarking of the best practices, of the experiences of other countries, and of course, parallel it with our own context. We should apply contextualization based on our local situation, our resources, the political structure, the government system, and other socio-economic factors. It was also mentioned here that the different um, important governmental values or political that has a lot of relation to political science, such as issue on transparency and accountability of our leaders, our policymakers, be it in the national or local level. These are or local executives. And of course, it was also highlighted the effective leadership and good governance, which is crucial, and the constructive engagement and proactive response to criticism. Public policy should be, this is the third one and the last one. After puzzles and perspective, now let's go to people. So public policy should be people-centric. It's about people, but it must not end there because it must be a public policy also of the people and for the people. So in that way, we are making the approach to be more of focusing on the democratic governance, which is the type of governmental system, the kind of politics that we have here in the Philippines. And then that's why I admire the setup and I commend the organizer here as well, that making this webinar to be like a town hall deliberation, wherein our resource speaker is not the source of knowledge or information, but you see the resource speaker serve as our learning partner. And you see the webinar being, as mentioned by our speaker, it's a joint inquiry. Like we are exploring all together. Okay. Social inclusion is important. That's why it's people-centric. It should be multi-stakeholder. There should be multi-stakeholder consultation, cooperation, collaboration, and coordination. Meaning, with this kind of people-centric public policy, you see that we are making sense of the people, and we're giving them the sense of belongingness and also sense of ownership to this endeavor. The importance of community participation in a whole of society approach in combating the COVID-19 pandemic is crucial. It requires strong complementarity among stakeholders, social institution, people, international community. So at the end, it's a collaborative, it's a cooperative engagement. And also it was highlighted, let me finish, that we just need to go back to the basic, just like solving a puzzle. But we also have to highlight our collective strength as people, our core values, our faith and spirituality, and of course, the learning from history so that we cannot repeat the same mistakes that we did in the past. It's also important that we take advantage of the opportunity given by this kind of, crisis or trying times to innovate. And then, of course, use future thinking and learn from the process, not just being focused too much on the product or on the solution. But as we go on through our journey, we are learning a lot from it. Thank you very much.
Thank you, Sir Ilo. Again, for those who would like to ask directly to our guest speaker, you can email him at rpescaladamt@gmail.com. Now we'll be awarding the certificate to our speaker. Allow me to read the citation. Far Eastern University awards the certificate of appreciation to Dr. Rainier P. Escalada, MIPP, MPM, for his valuable contribution as resource speaker during the second webinar series of the Department of Political Science with the theme COVID-19 and Public Health in the Philippines, Policy Gaps and Prospects, given this 9th day of October 2020 at Far Eastern University, Manila. Signed, Dr. Rowena Capulong Reyes, Dean of Institute of Arts and Sciences. Signed, Dr. Ildefonso R. Fulgar III, Department Chair of the Department of Political Science. So to close this webinar, let me call in our ever dynamic faculty member, Mr. Reynold Agnes, sir.
Hi, Sir Kev. Good morning. Can you hear me?
Yes, sir. Go ahead, sir.
Sir Kev, can you hear me?
Yes, sir. Go ahead.
Can you hear me? Hi, sir. Can you hear
Yes,
me?
sir. Yes, sir.
Okay.
Go ahead.
Thank you very much. So first of all, we would like to thank, of course, Dr. Rainier for sharing his precious time with us and for sharing his expertise to all of us. We also would like to thank the Political Science Department for spearheading this kind of activity. This is very timely, and of course with the support of the Institute of Arts and Sciences. And of course, we would like to appreciate the active participation of the students in this activity. Your participation was superb. So it's really great. And siguro after this webinar, I came to realize that COVID-19 is not bad at all. It's not bad at all because it's just like a practical examination to all of us. On our part, siguro, as electorates and as observers of Philippine politics, we put in test our choices of candidates. So in other words, given the situation, how did your elected leaders perform, or your policymakers? How did they perform? The way our policymakers troubleshoot the concomitant problems of COVID-19 manifests their work as policymakers. And it also manifests or a reflection of our quality as voters. On the part of the politicians, I think COVID-19 made them realize that joining politics is not an easy task, Kasi this kind of examination is not the same as the situational examination that we give inside the classroom. This is not an imaginary situation. This is a real situation that challenges our policymakers through their work. So they put forward their agenda, their solutions, etc. So I think that's one big challenge on the part of our policymakers. And as we can see here, very clear, in this webinar, policies are very important. In fact, these are the alternatives to the facts that everybody is waiting. And policies cannot kill the virus. They cannot kill the virus, but can lessen or even stop the spread of the virus, as shown in the case of Thailand, as shown in the case of Vietnam. In other words, na-stop ang pag-spread ng virus kahit walang vaccine, and it's all because of policy. So sabi nga ni Dr. Rainier kanina, may sinabi siya, hope is not a strategy. So habang
I guess nawala si sir. Okay, so I think we have a technical difficulty. I apologize for that one. Once again, thank you, Dr. Rainier Escalada.
Can you hear me, sir?
Yeah, okay.
Okay.
Nandito ulit si
Okay,
sir.
thank you.
Yeah, go ahead, sir.
Nawala ako? Can you hear me?
Yes, sir.
As I was saying, so as we are waiting for the vaccine, siguro the best thing to do is to continue developing policies. And this, I think, is very important by appointing qualified policymakers. This is very important. And I think we've seen this emphasis doon sa talk ni Dr. kanina. This webinar is like an actual checking of the practical examination, as it provided a framework for understanding policies and determining policy gap. So yung binabanggit kanina ni Doktor na the policy process, modeling his son, no? The puzzle of policy process. So this is the framework to understand policies and to determine policy gaps. So your inferences and realizations are the learning outcomes. So with this, we formally end this activity, and thank you very much, students, faculty members, and all participants. Maraming salamat po.
Thank you, Sir Agnes. Thank you to our speaker, Dr. Rainier Escalada. Thank you, everyone. We appreciate you being here. We would like to commend the support of our institute and our department, as well as the technical team behind this webinar, Rigel, Katrina, Diane, and Jaja. And thank you again for joining us today, and we will see you next time. Thank you, everyone. Bye.